Hi, I'm Dr. Larry Burchett. I'm a practicing ER doctor in the front lines of this coronavirus. And one common question that I'm getting both from friends who are texting me and my patients is who are worried about shortness of breath. How do you know if it's anxiety, which isn't going to kill you, or worsening coronavirus shortness of breath that you really need to go into the emergency department and be evaluated for? So I'm going to talk about the differences between corona shortness of breath and anxiety. Number two, what you could expect if you were to go into the ER. How do we evaluate that? And number three, what's one thing you can do to kind of test that really gives you a big clue and can relieve anxiety if that's the cause of your shortness of breath? Let's start with panic attack, shortness of breath. So the first thing is that the first thing that I think about with the person in front of me is, have you had this before? Do you have a history of anxiety, depression, panic attack? Are you on Xanax, Ativan, antidepressants, alcohol, these kinds of things? The symptoms typically of panic attack can be shortness of breath, chest pain, tingling. If it's a constellation of those kind of things, and really panic attack is somebody really having the experience like something is wrong and they're going to die, that sounds more like panic attack. Now let's remember what coronavirus, typically those symptoms are. Typically it's cough and a fever that starts anywhere from days after exposure. And then when it progresses, it gets worse to shortness of breath. So if somebody comes in and they said, oh, I'm short of breath, it's mainly at night, I'm alone, I'm just feeling so, stir crazy at home, and they don't have any other symptoms of corona from fever, cough, body aches, abdominal pain, vomiting, diarrhea, all those things can potentially be symptoms. If it's just shortness of breath, that may be more likely to be anxiety. On the other hand, if somebody comes in short of breath and they have had a fever and a cough for a few days, it seems like this is getting worse. That would make me think more viral, potentially corona, but it could also be asthma, could be related to allergies, could be another virus, could be pneumonia. I've seen valley fever. There's a whole lot of other things. Shortness of breath is not, there's a lot of potential causes of shortness of breath besides coronavirus. And then you would also want to think, okay, is my shortness of breath from coronavirus? Are you in a place where there is a lot of this going around, i.e. New York City? Or are you in a place where it really isn't circulating that much? That affects the likelihood or the risk that it could be that. And then the shortness of breath, one of the characteristics that makes me more worried that it's not anxiety and it could be something serious is when you're exerting yourself, going upstairs, a little bit of exercise, is it worse then? Anxiety, folks, on the other hand, I would ask, is it constant? Do you feel it all day long? Is it better when you're relaxed after you do a meditation? I had a patient where, I was talking with them about everything, and they said, well, I did this meditation. I felt a lot better. I didn't have the shortness of breath, and then it came back later. That sounds more like anxiety to me. Shortness of breath, because you have corona progressing, it's not going to come and go as much as something that may be tied to anxiety and feeling stressed out, okay? So those are kind of general differences. I hope that's helpful. If you have any question and you're worried, contact a health provider. The ER is always there for you to be evaluated. And in the context of corona, if you had symptoms for several days of cough and fever, body aches, all that stuff, that progressed to shortness of breath, that's when you really need to think about going in. So when you go into the ER, what do we do for you? What do I evaluate when somebody comes in and I'm looking at this to be like, is this something serious they need to be admitted to the hospital, or is this okay, they can go home, and is it anxiety? All those questions that we already talked about. But then also the first thing I want to do is I'll observe the person. With panic, you can be hyperventilating. It's kind of rapid, shallow breathing in and out. When somebody has lung disease and they're really struggling, they also would be breathing fast, but they're taking deeper breaths, really working. They're out of breath like that. A lot of times their color will change in their face or their hands. They'll be a little kind of bluish or grayish and not as well perfused. When you come in, we put an oxygen saturation on your finger. We want to get an oxygen level. Panic attack folks are going to be 99, 100. Even though they feel short of breath and they're breathing fast, they're still able to get plenty of oxygen into their blood. Once corona gets severe to ARDS or something else like pneumonia, the oxygen saturation can go down into the below 9 in the 80s. That's once it drops under 90, that's kind of when we were thinking people need supplemental oxygen, like on the nasal cannula, and they may need to be admitted to the hospital. Additional other things we do, of course, we check everybody's vitals. So we look for fever, your heart rate, blood pressure, basic blood work. Sometimes when people are short of breath, it's actually from anemia. Might do an electrocardiogram and look at the heart. So even with corona, there can be some cases of heart failure where the virus attacks the heart and the heart isn't working as much. That could make somebody short of breath. We would do a chest x-ray and look for kind of this classic bilateral infiltrates where there's white stuff all over both sides of the x-ray, which could signify pneumonia or ARDS from corona. So we check all of these things, and then I like to observe somebody. If you can give Ativan, if we can give kind of a sedative, light sedative medication, it often relieves anxiety. It takes the shortness of breath away. All their vitals are normal. Their blood work, the x-ray, all of that would be normal, and the Ativan would take it away. On the other hand, somebody who had real shortness of breath, give them Ativan, may help a little bit, but they're still going to have abnormal vital signs. We would expect to find something abnormal on the blood and the x-ray. If all of that stuff is normal, that would be very reassuring. And, the doctor evaluating the patient, checking all that stuff, may feel that it's okay for you to go home. But that's the kind of stuff. So these people that get really sick from corona, they have abnormal x-rays, they have abnormal blood work, their vital signs, especially that oxygen saturation is abnormal. Those are all the things that we're able to check in the ER to evaluate you for that. And if that's normal, reassure you that that shortness of breath is not you getting seriously ill. Depending on who it is, other thing that I would add is that what is your risk? Do you have asthma? Do you smoke or vape? If you do, stop. This is a great time to stop that because that just puts you at increased risk for getting in trouble. What's your age? Did you smoke your whole life and you have COPD, emphysema? That's going to set you up to get into more trouble. And it's still difficult to tease out because people that have smoker's lung and emphysema can get anxiety when they get short of breath, and it could be shortness of breath from corona or some other infection or heart failure or COPD flaring. So there's a lot of possibilities to think about, but I would be more concerned that it's not just anxiety with a history of asthma, COPD, lung disease, smoking, vaping, all of these things. So what can you do to kind of test this and see? And I think the answer is, for you, what can you do to get really, really relaxed? So I would recommend some kind of meditation. Close your eyes. You scan from head to toe, from your head down through your neck, your body, your belly, focusing on deep breathing, taking deep, controlled breaths. You do one of these grounding meditations that can really relax your muscles, your body as much as possible. And the longer you can do that and really kind of get into a deep meditation and relax. I had a patient that was able to do that and noticed, my shortness of breath, when I got into that meditative, really relaxed state, my shortness of breath was gone. That made me think that was more likely anxiety. Does that make sense? If you had advancing corona, it's unlikely that a meditation is going to make your shortness of breath better. I'm not saying don't do it to help with the symptoms, but it is not going to relieve that like it can for anxiety. Okay? So to review, those are kind of the differences that I see between, is this corona shortness of breath versus anxiety? That's what we do in the ER, evaluate you, checking your vitals, listening to the lungs, doing x-rays, lab work, and then try to do some relaxation meditation to see if you can get that shortness of breath to go away. That would make me think much more likely, especially today, so much stress and anxiety going around, that would be that. Hope you liked this thing. If you liked it, share. I've got this daily podcast going on. Check that out under Apple Podcasts and Spotify. And take care of yourself during this time. Know that we are going to get through this and be okay. And I'll see you next time.